Hi, my name is Jessica Littles, and today I will be performing the cultural and spiritual, FICO cultural and spiritual examination, as well as the 12 cranial nerve assessment on Mr.
Marquise Little,
And can you tell me your birthday?
9790.
All right, so I want to start off with my FICO assessment. So, Mr. Littles, are there any cultural or spiritual practices that you do affiliate yourself with?
Baptist.
Okay, Baptist. With your spiritual affiliation, will that impact your treatment on today?
No, ma'am.
And is there anything that I can do for you, implement it into your treatment?
No, ma'am.
And then next, is there any outside community resources you have
Yes.
that may impact
Oh, no,
your
ma'am.
treatment?
No, ma'am.
Okay. Well, we're gonna move over to the 12 cranial nerves. And do you consent for this assessment?
Yes.
All right, so we're going to start off with cranial nerve number 1. And with cranial nerve number 1, that's all olfactory, and that's a sensory nerve. So I just want to inspect your face, okay? All right. And do you have any history of traumas to your nasal area or any deviations?
No, ma'am.
All right. So first, I just want you to close your eyes for me, and I just want you to tell me what you smell.
Cinnamon.
All right. And then I have another one for you.
Coffee.
Okay. All right. So if he did say he wasn't able to smell those scents or had any abnormal findings, I would be concerned for any allergic rhinitis, any trauma to the area, or if you were a smoker, and even possible lesion on that cranial nerve. So next, I want to move over to cranial nerve number 2, which is our optic nerve. And this nerve is a sensory nerve. We're going to be dealing with visual acuity and confrontation, okay? So if you could, first I would like you to come over here. And we're going to be looking at the Snellen chart. And I'm going to ask him to stand at least 20 feet with the Snellen chart. And if you could, please read the smallest line you see.
LTFPH.
All right. So with the Snellen chart, he's able to read 20/20. He does have 20/20 vision, with the top number being 20 feet and the bottom number being what the average person can see reading at 20 feet. I would be concerned if he was reading at 2200, because that will be legally blind. So if you could please come over here. And I forgot to ask you, do you wear glasses by chance?
No, ma'am.
All right. Good job. All right, so next I'm gonna be using my fundoscope and looking into his eye. I'm gonna be looking at that red reflex, looking at the fundal disc, looking at the blood vessels, making sure they have good perfusion to the eye, and I'll be looking at the macula. With the macula, I'm not able to visualize that, and due to his eyes not being dilated. Okay, so I'm gonna pop this light on. All right. And if you could, please cover the left eye for me. And I'm going to make sure that my fundoscope is set down to the lowest setting. I'm going to start with 0. I'm going to just look for that red reflex first, and then I'm going to work my way in to look at that optic disc and that background of his eye and those blood vessels. So if you could, and I'm going to place my hand over my right eye. All right, just look at me. And I'm just looking. Okay. The red reflex is noted. All right. And I'm looking at those blood vessels, trying to see if I see pulsation to those vessels. All right, and looking at that background. All right. Alright, let me change my settings. Alright. So no abnormal findings noted with that fundoscopy. But if I did see any hemorrhaging blood vessels, I'll be concerned for any hypertension the patient may have. That would be a cause for concern. Or even retinal detachment. So next I'm gonna move over to my confrontation test I would like to do. So again, can you please place your hand over your left eye? And I'm placing my hands over my right. Okay? And I just want you to tell me when you see my eyes, not my eyes, my fingers wiggle, okay? Just say now.
No. 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 No.
All right. So that's cranial nerve number 2. So now we're going to move over to cranial nerve number 3, 4, and 6. These are our motor nerves. This is going to be our oculomotor nerve, our trochlear, and our abducens. With this, I'm going to perform the H test, and I'm just looking to see the movement of his eyes, and I'm going to be checking for nystagmus, strabismus, which is if he's getting cross-eyed, any droopiness to that eye as well. So first I just want to assess, and I'm just looking at your pupils, just making sure they're equal, round, and reactive. Just look at me. Okay. And I'm just looking to see if we have constriction, light, consensual. Okay. Just look. Alright, I didn't mean to do that. Alright, so I just want you to follow my pen now. Okay, I want you to look at a far object. Look behind me. Now look at my pen. Okay. Alright. So cranial nerve 3, 4, and 6 are intact. Next, I want to move over to cranial nerve number 5, which is my trigeminal nerve. And with this, I'm going to be, Mr. Littles be doing a light touch, sharp, and dull on you, okay? And I'm just inspecting his face, making sure it's symmetric. All right, and I just want you to clench your teeth for me. Okay. All right, clench one more time for me. Can you open your mouth and close it for me? Close it. All right, thank you. All right, can you put your hand out for me? And this is going to be sharp. And it's going to be dull, okay? I just want you to tell me where you feel it, and when you do feel it, okay? All right, close your eyes.
Sharp above right eyebrow. Dull above left eyebrow. Sharp over right cheek. Dull over left cheek. Sharp on the right side of the chin. Dull on the left side of the chin.
All right, and I want you to keep your eyes closed for me. And this is a light touch test, and I just want you to tell me when you feel it, okay? You can just say now.
Now. Now. Now. Now. Now. Now. Now.
All right, thank you. Then we're gonna move over to cranial nerve number 7, which is your facial nerve, okay? So with cranial nerve number 7, we're gonna be looking at more of sensory with this nerve and motor, okay? So if you could you smile for me? Can you frown for me? Can you puff your cheek, put air in your cheeks? All right. And so with this, I'm gonna be doing a taste test on 2/3 of the tongue. So I just want you to tell me what you taste.
Mm-hmm.
All right. Can you stick your tongue out for me? What you taste?
It's sweet.
Okay. All right, stick your tongue out for me.
It's sour.
Okay. All right. And so next, with the facial nerve is intact, but I will be concerned if he had any palsy, any paralysis to one side. And then as far as taste, I would be concerned with that sensory, and I would know abnormality, and if he had possibly even a lesion on that cranial nerve. So next, I want to move over to cranial nerve number 8, which is acoustic. Your acoustic nerve, and we're gonna see about your hearing and your balance, okay? So I'm gonna strike my tuning fork, and I just want you to tell me when you no longer hear this. I'm gonna find his mastoid, okay? Just tell me. right. And I'm gonna do your next one.
I don't hear it anymore.
Okay.
I don't hear it anymore.
All right. So I would be concerned if he told me he didn't hear as far as that mastoid, or even if it was unilateral, I'll be concerned for any hearing loss. Next, I'm gonna do the Weber test. The first test was the Ryan test. The next test is gonna be the Weber, and then we're gonna move over to the whisper test, okay? Just tell me if you hear it in both ears or one ear.
I hear it in both.
Okay, so if he did tell me he was only hearing it on one side or not hearing on either side, I would be concerned for either a conductive hearing loss or a sensorineural hearing loss, and that will warrant a referral. All right, next we're gonna do the whisper test, and if you could please cover your left ear. All right, and I just want you to tell me what you hear, okay?
1, 2, 3.
All right. I'm gonna come to the other side. You can cover your neck, please.
1, 2, 3.
All right. Weber test isn't, not Weber test, but the whisper test is intact. So cranial nerve number 8 is intact. Next, I want to move over to cranial nerve number 9, and we can actually test cranial nerve number 9, which is our glossopharyngeal, and cranial nerve number 10 together. Both of these nerves are motor nerves. All right. So with this, I'm gonna just assess, and I just want you to say "ah" for me. I'm looking at that uvula. Looking to see if it's moving up and down. There's no deviation, and that is midline. All right. Can you open up for me? All right, good. So with that cranial nerve number 9, we also gonna do another taste test with this, and we're gonna do this on 1/3 of the tongue. Okay. All right. You stick your tongue out for me? Tell me what you taste.
Sweet.
All right.
Sour.
Sour, okay. All right. So, and also throughout this assessment, his voice, his pronation has been clear. Have you had any history of hoarseness or any recent hoarseness?
No, no.
All right. So cranial nerve number 9 and number 10 is intact. And also with this, we will be doing, for cranial nerve number 10, we will be doing that gag reflex. So, let's see. All right, can you open up for me? All right, gag reflex is intact. I didn't hurt you too bad, didn't it? Okay.
No.
All right, so now we're gonna move over to cranial nerve number 11, which is our accessory nerve. And with this, Mr. Liz, I'm just ask you to shrug your shoulders. I'm just place my hands on top. Okay. All right, can you shrug for me? All right, and I'm gonna do this with resistance, noting if there is any one-sidedness, any paralysis. Have you had any traumas or hurt yourself recently with your shoulders? And I'm just checking that trapezius muscle. So next, I'm gonna just ask you to move your head for me against my hand, okay? Okay, and I'm just noting resistance, making sure that it's equal on both sides and he doesn't have any weakness. And those are motor nerves. Next, I want to move over to cranial nerve, our last cranial nerve, which is cranial nerve number 12, which is our hypoglossal nerve. And with this, I just want you to stick your tongue out for me. Move it up and down, side to side. I'm just looking for any atrophy to that tongue or any deviations to the tongue. And cranial nerve number, and also before that, before we end our assessment, can you push your tongue against my hand? All right. Can you push your tongue against my hand? All right. Resistance was met. It was symmetric. No issues noted with cranial nerve number 12. And that concludes our cranial nerve test. I thank you for participating with me.
Thank you.
All right. All right.